He had been monitoring his PSA for 4 years: 6.1, 6.8, 7.4, 8.2, steady climb, every 6 months. His urologist was becoming increasingly concerned. Biopsy discussion was on the table for the next appointment. Then his new internist reviewed his complete file before their first meeting. She looked at his PSA history, then looked at the dates of each test, then asked one question nobody had ever asked before. What were you doing in the 48 hours before each of these tests? He thought back. Most were morning appointments. He usually exercised before. Sometimes the night before was a special occasion with his wife. She said, "I want to retest you, under controlled conditions. No exercise for 72 hours before. No sexual activity for 48 hours. Blood draw before any physical exam. Nothing that could artificially elevate your result." He said, "Does that really make a difference?" She said, "In some men, it makes a difference of 1 to 2 full PSA points. Looking at your testing history, I think you may have been falling into at least 2 of the 5 most common PSA testing traps that seniors fall into, repeatedly. For 4 years, he retested under controlled conditions 2 weeks later. His PSA 6.3, down from 8.2, almost 2 full points lower, with no treatment, no medication change, nothing different except how the test was conducted. His internist said, "Your PSA may have never been 8.2. That number may have been a testing artifact all along. Today, I am revealing all 5 PSA testing traps that consistently produce artificially elevated results, and exactly how to protect yourself before your next test." Before we continue, quick reminder: this is educational information only, not medical advice. Proper PSA testing preparation should always be discussed with your doctor before your next test. And if you want a free PSA test preparation checklist, exactly what to do and avoid in the 72 hours before your next test, drop the word checklist in the comments right now. Now, all 5 traps, starting with the one that affected him most. Trap 1: exercising before your PSA test. This is the trap he fell into most consistently, and the one most men have never been warned about. Physical activity, especially vigorous exercise, temporarily elevates PSA. The mechanism involves mechanical pressure and microtrauma to prostate tissue during intense movement. This releases PSA into the bloodstream above the baseline level that actually reflects prostate health. Cycling is the most documented offender. Pressure from a bicycle seat directly compresses the prostate region. A study published in the British Journal of Urology International found that vigorous cycling raised PSA levels by an average of 1.2 points, with some men showing elevations of up to 2 full points that persisted for up to 72 hours after riding. Running, heavy weightlifting, and high-intensity interval training also show measurable PSA elevation in research, though typically less than cycling. He exercised the morning before most of his PSA tests. His urologist had never mentioned this as a variable. A survey published in Prostate Cancer and Prostatic Diseases found that fewer than 20% of men over 60 receiving PSA tests had been warned about exercise as a testing variable by their ordering physician. How to protect yourself. Avoid vigorous exercise, especially cycling, for a minimum of 72 hours before your PSA blood draw. Light walking is acceptable. If you exercised heavily in the 72 hours before your last test, discuss a retest under controlled conditions with your doctor before making any monitoring decisions based on that result. Trap 2: sexual activity before your PSA test. This is the trap nobody mentions at appointments, because most doctors find it uncomfortable to bring up in a brief clinical encounter. Ejaculation temporarily elevates PSA. The mechanism is direct. PSA is produced by prostate cells and released into seminal fluid. Ejaculation causes a measurable amount of PSA to enter the bloodstream above baseline levels. A study in the Journal of Urology measured PSA before and after ejaculation in men with no known prostate conditions. Average PSA elevation, 0.8 points. In some men, the elevation reached 1.5 points. The elevation persisted for up to 48 hours in most participants. For a man with a baseline PSA of 6.5, sexual activity the night before his test could produce a result of 7.3, triggering a very different clinical conversation than his actual baseline warrants. The American Cancer Society recommends abstaining from sexual activity for a minimum of 48 hours before PSA testing. This recommendation exists in published guidelines. It is rarely communicated to patients before they receive their lab slip. How to protect yourself. Plan 48 hours of abstinence before every PSA blood draw. Mark it on your calendar when your test is scheduled. This single step alone can prevent a false elevation that leads to unnecessary monitoring, escalation, or anxiety. Trap 3. Having your prostate exam before your blood draw. This trap is structural. It happens inside the appointment itself, and most men have no idea it is happening. A digital rectal exam, the prostate exam your doctor performs with a gloved finger, physically manipulates prostate tissue. That manipulation temporarily releases PSA into the bloodstream. If your blood is drawn after the exam rather than before it, your PSA result includes that procedural elevation on top of your actual baseline. A study in the Archives of Internal Medicine measured PSA before and after digital rectal examination in men attending routine urology appointments. PSA elevation from the exam alone averaged 0.4 to 0.8 points and persisted for several hours after the procedure. Standard protocol, recommended by the American Urological Association, is to draw blood for PSA before performing any physical examination of the prostate during the same appointment. But in busy clinical settings, this sequence is not always followed. Blood draw happens at check-in. Exam happens with the doctor. The sequence varies by clinic and by staff workflow. How to protect yourself. At your next appointment, when you check in for blood work, confirm with the nurse, is this blood draw happening before my prostate exam? If the answer is unclear, ask your doctor directly before the exam begins. One sentence. It protects the integrity of your entire result. Trap 4. Recent urinary tract infection or prostate inflammation. This trap is medical rather than behavioral, but it is one most men never connect to their PSA result. Urinary tract infections, prostatitis, inflammation of the prostate, and recent urinary procedures all cause significant temporary PSA elevation. The mechanism is direct inflammation of prostate tissue, releasing PSA into the bloodstream well above normal baseline. A study in European Urology found that men with active prostatitis had PSA levels 2 to 10 times higher than their established baseline, with elevations persisting for 4 to 8 weeks after the infection resolved and inflammation subsided. The clinical trap? A man develops mild urinary symptoms. He does not connect them to his prostate. He goes for his routine PSA test. His result comes back significantly elevated. His doctor sees the number and schedules follow-up investigation without knowing that active inflammation was present at the time of the test. A 2021 review in the Journal of Urology estimated that unrecognized prostatitis contributed to PSA elevation in a meaningful percentage of men who subsequently underwent unnecessary further investigation. How to protect yourself. Before your PSA test, tell your doctor about any recent urinary symptoms: burning, urgency, frequency, pelvic discomfort, even mild symptoms. If prostatitis or UTI is suspected, your doctor may recommend treating the infection first and retesting 4 to 6 weeks later before making any monitoring decisions based on an elevated result. Trap 5. Certain medications and supplements affecting your result. This is the trap that surprises men most, because it cuts both ways. Some medications artificially lower PSA, some artificially raise it. Both produce results that do not reflect the actual state of the prostate. Medications that lower PSA and can hide a true elevation include finasteride, sold as Proscar or Propecia, and dutasteride, sold as Avodart. Both are commonly prescribed for benign prostate enlargement or hair loss. Both suppress PSA by 40 to 50%. A man taking finasteride with a true PSA of 8 may show a result of 4, appearing within normal range while his actual level remains significantly elevated. The American Urological Association guideline states clearly, if a patient takes a 5-alpha reductase inhibitor, their PSA result must be doubled to estimate their true baseline. Medications and conditions that can raise PSA include testosterone replacement therapy, NSAIDs taken regularly, and certain herbal supplements including high-dose saw palmetto, which has unpredictable effects on PSA in some men. How to protect yourself. Before every PSA test, give your ordering physician a complete list of every medication and supplement you take, including over-the-counter products and herbal supplements. Ask directly, does anything on this list affect how you interpret my PSA result? That one question ensures your doctor is reading your number with complete context. His internist gave him a simple protocol before his retest. 72 hours before the test, stop all vigorous exercise, no cycling, no running, no heavy lifting, light walking only. 48 hours before, abstain from sexual activity. Day of the test, arrive without having exercised. Confirm blood draw happens before any physical exam. Inform the nurse and doctor of any recent urinary symptoms. Bring a complete medication and supplement list. He followed every step. PSA result, 6.3, down from 8.2. His internist said 6.3 with your prostate size and free PSA ratio is a very different clinical picture than 8.2. We monitor carefully, but the conversation about biopsy is no longer on the table based on this result. He said, 4 years. I followed none of these steps for 4 years. She said, most men don't, because most men are never told. Now you have been told. Imagine your next PSA appointment. You followed the 72-hour protocol. No exercise, no sexual activity, blood drawn before exam, urinary symptoms disclosed, medication list in hand. Your result comes back. You know, for the first time, that this number actually reflects your prostate. Not your morning run, not last night, not a procedural artifact, not an unrecognized infection, not a medication interaction nobody accounted for. That is a fundamentally different starting point for every conversation that follows. He had 4 years of results that may not have reflected his actual baseline. One controlled retest gave him, and his doctor, the real number. You deserve to know your real number. 5 traps, 1 protocol. That is the difference between a result that reflects your prostate and a result that reflects how your test was conducted. Share this with one man over 60 who has never been told any of this before his PSA test. And drop checklist in the comments for the free PSA test preparation checklist. Everything to do and avoid in the 72 hours before your next blood draw.